Okay, and we are live. Hello, everyone. Thank you for joining us. This is Healthy, Wealthy, and Smart Live. I am your host, Karen Litzy, and I am joined today by Jennifer Stevens-Lapsley. So, Jennifer, welcome.
Thank you. Thank you for having me.
And so what I'll have you do is tell the listeners a little bit more about you and what you do.
Absolutely. So I'm a professor of physical therapy at the University of Colorado in Denver, technically in Aurora, but Denver, Colorado. And my research, I'm predominantly focused on research in older adult populations, looking at rehabilitation strategies to maximize physical function, improve the speed of recovery. And I have done research in patients with joint arthroplasty in older adults for about 20 years now. I graduated from the University of Delaware with my master's in physical therapy, and then I went on to get my PhD at the University of Delaware as well. And then I did a fellowship down at the University of Florida and came out to Colorado after that. So I've been enjoying the lifestyle out here in Colorado ever since.
Nice. And if you are, for all of the people who might be on right now, if you want to type your name and where you're from, or if you have any questions as we're going through, or any comments, please do give those comments, because we would love to hear them and start even a little dialogue with you as we go through. So as people are coming on, just be sure to write down who you are and where you're coming from. And again, if you have any questions, we'd love them. So we're going to get this talk started. But before, I just want to preface that a couple of weeks ago, I did an interview with Michael
Badi, yes, my colleague here at the University of Colorado.
Right, and we were talking about the differences between residencies and fellowships. So today we're going to be talking more about PhD programs. So another track that you can do after you get your DPT in physical therapy. So can you quickly tell us the differences between a PhD program and a residency and or fellowship?
Absolutely. So it depends on what your goals are as to what's going to be the right path for you. But typically a residency or fellowship is much more geared towards specialization in a particular patient population. So really narrowing down and becoming an expert in a particular subgroup of patients, developing case studies on individual patients, maybe going into more management and related types of roles down the road as well. Whereas a PhD is much more geared towards individuals who might have a passion for teaching or practicing in research, or getting involved in clinical research, asking questions that are probably a little bit more broad, looking at questions that are going to change kind of the way that we practice across, in the field of physical therapy for those of you who are interested in PhD training in kind of a rehab arena.
And with PhD training, you're doing original research. Do you have to do original research?
No, there's a lot of different types of things you can do once you have a PhD. You can certainly look at questions that don't involve original research. Many individuals have questions that involve like a systematic review or meta-analysis of existing literature. And so there are lots of different ways you can use that PhD training to answer really important clinical kind of questions and direct the field.
And, before we went on air, we were speaking a little bit, and we were talking about PhD training and goals and things like that. So one of the things that's so important, I think, before you even decide that, yes, PhD is for me, is you should really know your ultimate goals, or those long-term goals. So can you speak to goal setting and things like that for people who are thinking about a PhD?
Absolutely. I mean, I think really it comes back to the question of, are you interested in really focusing your time and energy on patient contact more exclusively, like in a clinical, in a residency or fellowship, versus PhD training? And again, there's such a myriad of ways that PhD training can unfold. I should have mentioned I'm the director of the Rehab Science PhD program here at the University of Colorado, but I've had experience with a lot of different PhD programs, and they really do come in all shapes and sizes. And so as far as your goals, are you interested in going into more of a teaching role down the road? Maybe you might want to choose a program that allows you to get more experience in the classroom. Are you interested in a research career? Then you really want to choose a program that has a history of funding and a history of teaching individuals how to write grants and how to be competitive for those types of mechanisms. Are you interested in asking, more education-based types of research questions. So in the classroom, scholarship, kind of how do we teach individuals to be more effective educators and relay information in ways that students have a faster uptake of key content. And so those are all important things to consider as you're kind of thinking about what your goals are if you're considering a PhD. And then I always add the caveat of your goals can change too. And once you're in a PhD program, I've certainly seen many times where people think they want to go one route and they choose kind of to go a slightly different direction. Once they get immersed in research, for example, they might say, oh, you know what, I really like this. I was one of those people that thought I was going to get much more immersed in teaching than research when I first got my PhD, and here I am, much more, I'm invested in teaching, but much a greater percentage of my time is spent on clinical research. So keeping an open mind while still having some goals and some direction kind of is important, so striking a balance between those two.
Yeah, and that kind of leads into my next question, which I think you answered a little bit already, but that's how do you choose the right PhD program for you? So what kind of qualities should you be looking for in a PhD program? Obviously, you answered a couple of them just now, talking about depending on your goals, if you want to be in an institution that's more geared towards research versus teaching, but what other things can students, so if there's any DPT students now, or let's say new grads who are thinking, I want to go and get my PhD, what is your best advice for what to look for in a PhD program?
Yeah, no, great question. And it's one that we get asked quite a bit. Really, the track record of the mentors in the program is one of the most important considerations. So looking at, what the track record is of the mentees underneath a mentor. Have they been successful? Have they been able to be productive, talking to the mentees and getting a feel for their experiences and the mentorship style? So regardless of the structure of a program, selecting the right mentor is going to be really critical. Making sure that your learning style matches the mentors, as well as making sure whether you want to be in a big lab and a small lab, the resources are there to answer the types of questions that you might want to answer. And so those are things I always emphasize. Are there additional interdisciplinary training opportunities as your interests might grow? Are the campus resources and the lab resources extensive? Do you want to be on a medical campus specifically? Is that not as important to you? So those are some of the things that we tend to highlight. The other piece is, how much, in terms of the curriculum, how course intensive is the program? So if you're someone who really learns better by doing instead of being in a classroom, you should probably be in a program where the number of credit hours required to complete the PhD is less and more focused on practical learning experiences. And there are many programs out there, I think, that's a really key consideration. Some programs have twice the number of credit hours, and so you really do spend quite a bit of time in the didactic portion. And if that's not something you're interested in, you really should choose something that's a little lighter in that respect. You can still get a really good quality education with the hands-on approaches. So that's another really important consideration. And then, what is what's the environment like outside of school, outside of work? What's the work-life balance?
You mean you'll be doing something outside of school?
That's the hope, right? You spend a lot of time, certainly in the training phases, but you have to have a balance. So what does that look like? And is the environment, the location, the other things that you're passionate about, are they still going to be readily accessible to you so that you can have that work-life balance?
And, you were speaking about all of these things to look for in the program, whether it be the type of mentors, the track record, the type of programming. Is all of this readily accessible on university websites?
That is one of the biggest challenges, I think, out there right now. There is a website through the APTA that lists all the PhD programs in the country, but you really have to do quite a bit of digging to kind of get into the details of each of these programs. Are they full-time? Are they part-time? How long does it take to graduate? It was rarely published. So you have to be willing to kind of ask a lot of questions and put some time into the detective work. So maybe you narrow down the programs on the basis of some geographical constraint. You want to be in a certain part of the country, and so I'm going to look at these 5 programs, and I'm going to start there, ask questions of the mentors, contact the director of the program, contact the people that are listed as potential mentors, ask them for names of their mentees, and then start to kind of piece together the story of what that environment would look like for you. But unfortunately, it does take a lot of legwork. There's no one central resource at this point in time.
Okay, well, that's good to know, and I think it's good for people watching to know as well.
Yeah.
Now, you kind of just said part-time versus full-time programs. So let's talk about part-time versus full-time, and can you also touch upon the long-distance learning versus having that on-campus learning?
Absolutely, yeah. So those are really important distinctions depending on what your goals are. So it kind of comes back to your question about the goals. I'll start with the long distance versus being on campus per se, whether you're on campus in a full-time or a part-time program, or typically long distance will usually be a part-time program. And there are pros and cons, of course, but a lot of long distance programs, I have a lot of students contacting me saying that they feel a little bit more isolated. So it depends on how the program is set up in terms of the interaction amongst the existing students, maybe discussion boards or chat rooms or resources with faculty. But a lot of times those students end up feeling like they don't have the benefit of bouncing ideas off of colleagues and growing quite as much. However, it addresses one of many challenges, which is if you can't move to do a PhD and you're limited geographically, then it may be that that's a compromise that you're willing to make in order to get the PhD. When you're talking about kind of on-site types of training, part-time and full-time programs both exist, and the on-site training is really you'll go through the program faster if you do it full-time and often with more immersion, but there's certainly a lot of really good part-time programs that allow for you to work while maybe not full-time, maybe part-time, while you're completing your coursework. And so my experience here, we have a part-time program and a full-time program, is the individuals that are involved in the part-time program will often take maybe 6, sometimes 7 years to graduate. It depends on the student. Whereas our full-time program, our target is closer to 4 years.
Okay.
So there's a trade-off there. It's
a time commitment. Yeah.
It is a time commitment, but in a lot of cases, if you have family and other constraints, the part-time program might be the best option. You have a mortgage on a house. You, from a financial standpoint, can't give up your current job. However, the full-time programs, when you have that full immersion, you generate a much faster track record of productivity, which tends to launch your career a lot more quickly. And if you're in research, it serves as kind of that momentum to really lay the foundation for future work. So I often encourage people who really are passionate about research to go the full-time route if they can, because it helps propel them forward.
Got it. So it's all about trade-offs, it's all about what can you endure at this point in time and in your life. And
exactly.
I think it's great that people have all of these different options.
Yes, and I think the options continue to grow. And so I think that it is nice to have a variety of options to figure out what's going to fit your individual needs.
Perfect. Now, we talked a little bit about mentors. And from what I've been told and other people that I've interviewed about PhD programs, it's all about the mentor.
Yes.
So, and you certainly said that when you're looking for your PhD program. So what should one look for in a mentor?
Yeah, so that great, really important question. Again, it's about the fit with your learning style. So if you're someone who really likes hands-on kind of mentorship with one-on-one feedback on a very regular basis, you should make sure that your mentor is available, or the team that you'd be working with, the mentor team, is available on that level. If you're someone who really likes to work on your own and you're much more productive individually, then maybe a mentor that has more of a hands-off approach is appropriate. So that's an important characteristic. And then let's see, other mentorship characteristics. History repeats itself. So what's again the track record? If you're moving into an environment where someone hasn't published as productively as other people in the field have, chances are your experience as a mentee isn't going to be quite as productive in that arena. if your mentor has a history of writing grants, chances are you're going to get more experience and exposure. And so really figuring out what that match is. If your mentor is really passionate about teaching, you're probably going to get a lot of exposure to teaching strategies and techniques and things like that that are going to make you a very effective educator.
So if you're interviewing at different PhD programs, these are questions you want to ask, right?
Absolutely, yes.
Okay. Mm-hmm. And you shouldn't be afraid to ask these questions.
Absolutely. It's a two-way street. So I consider, one of my colleagues said this many years ago, that PhD, finding the right mentor for a PhD is almost like a mini marriage, because it's a very close working relationship where you really have that one-on-one contact for an extended period of time. And you shouldn't be afraid to ask questions to evaluate the fit for both you, and the mentor shouldn't be afraid to ask questions to really probe and make sure that you're the right candidate for their environment as well. Because it's a commitment. It's a very rewarding relationship. Yeah. It's something that I love mentoring students. I'm passionate about trying to infuse the knowledge and the resources and the things that we need in order to advance our profession. But we certainly look very closely for the right candidates that are a good fit for our environment.
And how about mentoring the non-traditional student? So the student that maybe has a family, mm-hmm. and who has, very kind of important obligations outside of their PhD studies, or maybe they just got married and they want to start a family in the middle mm-hmm. of their PhD studies.
Absolutely.
How do you do that if you're the mentor?
Right. So we've certainly had all those scenarios, and I think really more and more recognition towards different mentoring strategies and styles and timelines, and working with individuals as individuals instead of kind of a one-size-fits-all approach is really critical, and trying to understand the timeline for one person is going to be different than the timeline for the next person because of these individual other important priorities in their lives. And so all those things can be worked around. I think my experience has been that if you are really focused, regardless of these other life pieces that may come into play, if you're a really focused individual, you can still balance and juggle these things. And as a mentor, it's important to set deadlines and to set boundaries, because it's also easy in life to get distracted. And PhD training, is the challenge with it is it's not as structured as residency, fellowship, DPT training. You have a lot of free time and a lot of open-ended kind of, you need to get this done in the next 6 months. And when people have a lot of other things going on outside of their PhD studies, it's important to make sure that the environment that they are in has enough structure that they're going to be able to kind of be held accountable for their benefit to complete their studies in a timely manner.
Yeah, that makes sense. So you're still mindful of the priorities outside of the program, but at the same time, you have to have a little bit of structure so that person isn't just sort of off in their own world and then prolonging perhaps their experience and not getting to where they want to get in a timely manner.
That's exactly right. Okay. Everyone, there's a certain element of deadlines for a reason. And so when there's some accountability and some targets, mm-hmm. And sometimes the targets get missed, but at least there's a target and a trajectory that kind of keeps people on track so that they're not 10 years down the road wishing that they had finished their PhD 5 years ago. Right.
That makes sense.
Yeah.
And now we just had at CSM in New Orleans a great panel on the CSM panel, After Dark panel. Mm-hmm. The CSM After Dark panel that was all about diversity in physical therapy, inclusion, equity for people of different races and genders and socioeconomic backgrounds and sexual orientation. Mm-hmm. So are there mentors, are there programs within a PhD framework that can help to support some of these students? Because as we were saying before we went on the air, something that this panel, this After Dark panel did, was it showed other people of color that, wow, there's Lisa Van Hoos. She has her PhD and she's a professor at the University of Arkansas. I can see myself in her.
Right, absolutely.
It's important for the profession, and certainly important to have this broad range of deep thinkers.
Right, absolutely.
So what have you seen, whether it be at where you are at, or other schools across the country, as far as helping to
increase that pool, the diversity. Yeah, no, I think one of the strengths of programs across the country is that they're starting to recognize this need, and there's more and more. Like I went through a class that was really focused on mentoring and diversity, and how do you really truly cater to a lot of different viewpoints, and whether they're cultural, whether whatever the differences are. One of the things that's really nice is that NIH offers some funding, so there are some mechanisms for diverse candidates, and so that increases the likelihood of having some funding while you're a PhD student, and gives you that track record. So it gives you a little bit of a leg up for future opportunities, and so we're starting to see, just in general, more awareness along those lines. And I'm really pleased to see that. We've had a number of our trainees qualify for these diversity supplements and scholarships and things like that over the past decade or so in our program, and it's been really rewarding to see that. Still have a ways to go. We still need to continue to increase the diversity of our candidate pool, but we're making progress.
And that's good. And I think, like I said, the more younger therapists coming up who can see themselves, and more experienced therapists, I think it's a great way to kind of
role model.
To role model. So you have one, and then maybe 5 see, and then 20, and then 50, and then it just kind of keeps growing, which is maybe overly optimistic on my part, but I don't think so. I think the more that people see other people that look like them and sound like them, and it just makes for a much more well-rounded pool of people and thinkers.
Absolutely.
That only build the profession up.
That's right.
Now, I don't know how many PhD programs are there?
Gosh, I honestly don't know.
Probably a good amount, right?
A good number in the country. I mean, I think the question is how many are specific to like rehabilitation science or movement science.
Right, yeah.
And I don't know off the top of my head, but the APTA website really does a nice job of breaking down the ones that are more specific to rehab, which I think is another important question people ask. Well, should I get a PhD in a rehab movement science related field, or can I get a PhD in psychology or another area? And you can do either. However, I think if you're really going to ask clinically relevant questions from the beginning, rooting your training in kind of a rehab science arena makes a lot of sense. And looking for interdisciplinary partners that kind of help expand the way you think on a campus is probably the way to go, because when you remove yourself from the rehab arena, it can be more difficult to kind of anchor some of those early questions.
Yeah, that makes sense. So for any students listening, or people who are interested in moving into a PhD program, what can they do to make their application stand out? Because it's not like you're accepting 500 people,
Right. Absolutely. One of the things that we look for the most is some experience in research. And the reason I think PhD programs tend to look for this is, and this is hard because clinicians don't often have that type of experience. So anything you can get to give you that type of exposure. The research process is incredibly rewarding, but it's not like patient care, where you see a patient in front of you and within a week or two you see progress. There's a much lengthier timeline in order to see gains and improvements or impact. And so one of the reasons why it's important to have some of that experience is to make sure that that's right for you, that you have a tolerance for that kind of the long haul approach, with potential for a much bigger splash at the end than just treating individual patients. But you have to have a real willingness to kind of stick with it as far as the research questions that are being asked. So I think that's just getting that type of experience or exposure. Staying current with the literature. I mean, one of the things that clues us in right away is, even if someone doesn't have a lot of research experience, can they ask questions because they've read the literature, they know the latest and greatest techniques in a certain area. They can synthesize the literature. They can evaluate kind of what are the next logical steps for clinical questions to be asked. So that's important, especially if you haven't had research experience, to at least come in knowledgeable in that arena. Yeah,
that makes sense. And how would one, if I'm a treating clinician, how would I get involved in research?
Yeah, that's one of the hardest things, I think, because it's hard to just walk in the door of, I usually encourage people to seek out their local academic institution, like what's closest to you.
Like
And
Columbia or
see,
NYU or
exactly, right. And see, is someone working, it doesn't have to be in an area that you're well-versed or passionate about, but something in the rehab or some research-related realm where you could just get your feet wet and you could start to get some exposure. And that's one of the best ways to kind of get that initial kind of foot in the door.
Okay.
If you're a DPT student, get involved while you're a DPT student in some aspect of research, because it's so much easier to do it while you're there and completing your training. But there's certainly opportunities later down the road. Go to CSM and talk to colleagues about opportunities. Sometimes, we're able to arrange for a long distance type of opportunity or project or things like that to get people a little bit of exposure. So start just networking, connecting, asking around, where are those opportunities? Great.
Well, that's great advice. And now we saved the best question for last. Mm-hmm. How do you pay for all this?
That's probably the question I get the most. Yes.
You just got out of school. You're 100+ K in debt.
Yes.
Who wants to take on more debt?
That's right. That's right. So I think so there's one thing that I really want to emphasize, and that is that loan repayment grants through the National Institutes of Health, through NIH, will pay back 100% of your federal loans. And we've had an incredibly high rate of success at students getting those loan repayment grants. Some of them have gotten them as PhD students. Some of them have gotten them as fellows, postdoctoral fellows. Some of them have gotten them as junior faculty members. And so I really emphasize, don't go out and practice for 5-10 years to pay off your loans with the intention of coming back and getting a PhD. Have the government pay off your loans. Go back to school earlier.
That sounds better.
And then you don't have to deal with $100,000 of debt. But the other important distinction is that if you have a full-time program, usually you have a stipend, and usually your tuition is covered and your health insurance are covered. So, for example, our program offers a $30,000 a year stipend plus health insurance and tuition. But if you're part-time, you're going to pay your own tuition and your health insurance. And so that's the financial trade-off. You're also, in a full-time program, a lot of times eligible for a lot more scholarships. And one of the key elements that I emphasize is your earning potential. We've done the math. Your earning potential is such that you can work later in life as an academic, so you make it up in the long run. And you really don't end up in as much debt as you might think when you look at the difference in salaries between clinical salaries and academic salaries. We've estimated that a PhD with some scholarship funding, you might have $50,000 lost earnings, but you might have paid off $100,000 of your debt in your loans, and that $50,000 is likely to be recouped in the first 5 years of a faculty position, and then further recouped down the road. So while people see the finances as the ultimate barrier, our math suggests that it shouldn't be. It's really going back to school earlier and having the government pay off your loans. You don't need a lot of clinical experience. You need some exposure to ask the right questions, and then partnering with clinical colleagues. But don't go out and work for years and then go back and not have the advantage of having someone else pay your loans off for you.
That makes a lot of sense. How easy are these NIH grants to get?
We've had an 80% hit rate in terms of success in getting these loans funded. So they're much, much better than most NIH grants. Now that's true. That again comes down to the environment you're in too. So you want to be in an environment where there's a track record of success and mentoring.
So that's another thing to look for in a PhD program. If you're looking around, you can ask, hey, what is your success rate with NIH loan repayment?
Exactly.
Good. That's a great tip. So for everyone watching out there, that is a huge tip if you want to go on for a PhD.
Yeah.
Well, that's huge because that's everyone's, question is how am I going to pay for this?
Yes,
right. That's
number
one question. No. So now before we wrap things up, what are some key takeaways that you would like the audience to get from this discussion?
Sure. If you're interested in PhD training, an academic environment is such a rewarding environment to work in. There's so much flexibility. There's a lot of opportunities to grow however you want to grow in terms of your career. And I really love there's never kind of there's always a new and exciting kind of opportunity right around the corner kind of feeling. So it's really just remarkably rewarding to be in this environment. And I would encourage people not to be scared about taking that next step, because it really, it's a big step, but it'll pay off if it's the right match for your interests. And I also, again, encourage people not to wait too long, because we don't have a lot of evidence to suggest that years of clinical experience translates to a better academic career than just getting out there and working for a year or two and coming back and hitting the ground running and being in academia earlier in your career.
Okay, great key points. And then the last question I ask everyone, I probably should have prefaced this before we started, but I forgot. That is, knowing where you are in your career and in your life, what advice would you give to yourself when you graduated from the University of Delaware all those years ago as a new PT?
I would probably say that I would have spent more time on kind of what you just described. The mentor piece is probably the most important factor, not necessarily the area in which they're what they're studying. And I think a lot of people say, I want to go into this area, so I have to find a mentor that studies that area. And that's not really necessarily what's going to make you successful. I was really fortunate to have a lot of really good mentors along the way. It's more about the quality of the mentoring than the actual subject matter that you're studying. Once you understand the research process, you can apply it to any patient population out there. And so being open to mentors that may not match your exact patient population where you're the most passionate, but you'll learn the skills and you'll end up a better researcher, a better educator, better academic in the long run.
Perfect. And where can people find you if they have any questions or want to learn more?
So I would be more than happy to answer questions. I am really invested in trying to make sure people make the right decisions for their academic paths and PhD training in particular. And I can be pretty easily, my name's a bit of a mouthful. The Stevens-Lapsley part is a bit of a mouthful. But if you go to the University of Colorado Physical Therapy program and look under faculty, I'm the director of the Rehab Sciences PhD program. You should be able to link to my email, and certainly feel free to shoot me an email with any additional questions. And I have a number of resources and things like that, cheat sheets, fact sheets, things like that people have used to help guide kind of the questions they should be asking, and considerations that we've covered some of, large amount of in this particular podcast.
Great, thanks so much. And Christina says, thank you, this was really helpful. So thank you to both. Thank you to both. So yes. Thank you, Christina, for listening. And thanks to everyone else for listening. Thank you, Jennifer, for taking the time out of your day today. And everyone, I hope you have a great rest of your night and stay healthy, wealthy, and smart.
Thank you.